Hello and welcome back to Honor with Dr. Pete. As you know, we're honoring May as Mental Health Awareness Month, and all month long we've got incredible guests, and today is no different. I've got my friend and colleague, Dr. Erica Lander-Viller. She is the founder and clinical director of the Behavioral Care Center of New Jersey. She specializes in the practice cognitive behavioral therapy, which you've heard a lot of on this podcast, DBT, motivational interviewing, and ACT. And she works with children, adolescents, and families. So we go way back. Welcome to the show, Dr. Miller.
Thank you, Dr. Pete. Quite the introduction.
Well, you earned all of it. Wait, when did we meet?
No, I was thinking about this just a few moments ago.
Yes, correct.
I was trying to remember because I feel like I've known you forever.
It does feel that. Well, we're like siblings from another life, probably.
Absolutely.
Yeah.
Like that.
I think it was from ACBS New Jersey. You and I were kind of leading this charge. By you and I mean you were leading this charge to bring the Association for Contextual Behavioral Sciences to New Jersey.
I think that was both of us. I think we both feel really strongly about providing good care and trying to help support other clinicians who are also interested in bringing good, solid, mindful, compassionate care.
Well, that's exactly. And immediately, so I'm remembering, well, there was a bar, we had like a candy store once that we did this at.
It's about shame at a chocolate shop. What congregation than that?
Well, see, but you were the brain behind that type of stuff. Like the fact that you so quickly were just like, show them at a chocolate candy store.
Yeah, there are two of us who help run those. I think that we both feel strongly about you can continue to grow intellectually and provide great care, have fun.
Yeah, yes.
You don't have to be either or.
Well, not either. Well, and how beautiful from a mind, the dialectic.
It is both and enriching.
So describe that for some listeners that are just tuning in and maybe don't know what DBT is. I'm going to jump right into that. So the both and.
Yes, both and. So DBT, dialectical behavior therapy, we could not have come up with a more confusing name for it. Right?
Thanks, Marsha.
Thanks, Marsha. You're brilliant. And simple language. So dialectical behavior therapy, what I love about dialectical behavior therapy, it felt like a natural fit for me.
Yeah.
Because at its core are dialectics. And dialectics, for those of you who are new to dialectic, are two things that appear to be opposite and are both true. Right? So growing up, my best friend was my brother. I love him to death. He's hilarious and funny and wonderful. And man, if anyone knows how to get under my skin and say just the right thing, it's also him.
Yeah.
He knows exactly how to tease me, and he is also my favorite person who makes me laugh and is wonderful at the same time.
I love that. Shout out the other Dr. Jeffrey Lander.
That's right.
Yeah, well, the other Dr. Lander. I still have you in the phone that way, though, just so you know. Is that okay?
That's absolutely half the people in my world still call me Dr. Lander.
Okay, so her married name is Miller, and her brother is a wonderful human who I also know. He's he's one of the only sport cardiologists in the state.
And brilliant and funny.
Just like you.
Uh-huh.
Just like you. Brilliant and
great.
Brilliance and humor.
And humility, clearly.
Wait, so you work predominantly with children and adolescents. That's one thing that's not similar about you and I.
That's right. That's right. I love working with kids and with adolescents. I feel like you can help shift the whole trajectory that's in front of them and shore them up and help them be resilient and face the world ahead that is going to have bumps in the road that are natural.
You've always done that? Like you've always felt gravitated towards that?
So my long story short,
Yeah.
I started working with kids in middle school.
Come on.
So my short story starts in second grade. It was the first time I was in New York City with my family, and it was the first time I was mindful and aware of the unhoused population.
Uh-huh.
And I was shocked and asked my parents. We had a conversation about how that can happen. And that night we came home into our cozy house, and there was a huge thunderstorm, and I couldn't stop thinking about the people I met today who were like out in the rain, and I was asking my parents what happens, where did they go, and wanted to help. Stuck with me. And as a kid, the way they allowed me to start helping was working with kids, right? They weren't have me help out with adults. So I started in middle school, really starting to volunteer and work in some shelters.
Yeah.
And so they had me helping out with kids. And so it really started that way. And then I just, as I got older, I continued to love working with kids and with teenagers. So that just continued.
One of the most amazing things about doing podcasts like this is that as close as I feel to you and how much I love you, like I'm going to learn about you today. And I'm so glad you shared that, because that to me makes so much sense, because and if anyone listening, that's the depth that you bring to your work. And I know that about you, and I just know, whenever I refer to you, which is often, I have zero questions about it. I'm like, this is absolutely the person for you.
Thank you.
Yeah.
I feel the same way sending people.
Sorry, listeners, you have to just deal with
So much love in their
too much love. So parents are struggling.
Parents are struggling. Kids are struggling. Parents are struggling. It's parents have been struggling for a long time, and then COVID happened. I was actually just at an interesting training a week or two ago talking about the intense spike up in stress that parents experienced during COVID.
Yeah,
those rates of stress have not returned to pre-COVID levels.
So that's wild, because a lot of stuff has returned.
A lot of things have returned. And that is one thing that has not come back down, is the intensity of stress. Parents are reporting it just sort of has stayed at COVID levels, even now that the world has opened up and we're getting back to life as normal.
Let me ask you this. Where I was trained, and similarly to you, but my training is a little bit different. I had a lot more psychodynamic faculty, and so it was like no pictures in your office and like that sort of blank slate. Do your clients know that you're also a mom, or like how do you integrate that into your work?
They do. So I was not trained from a blank slate perspective. So kind of what was taught to me in grad school was, what are you sharing, and is it for the best interest of the client who's sitting?
Yes.
If you are sharing something personal is going to be useful, then you share it. If you're just like, hey, me too, that's not useful, and that's not a moment that you share. Becoming a psychologist before I had a family also made it impossible, because they watched an engagement ring pop on my finger one day. They watched me physically become pregnant, right? And so even if I believed in a blank slate, as you are physically changing in a way that's observable to everybody, it wasn't an option. And I also, especially with kids and the teenagers, you want to prepare people for transitions.
Yes.
And if you're going to be out on maternity leave, you have to prepare people, and going to take care of your own child and pausing taking care of someone else can be full to the person who you're pausing with. So making sure we had conversations about it in a way that felt like the just right amount of sharing.
I always say that this age group that you work with has the best bowl poopy meter.
The best. Yes. If you are not genuine, it's so interesting working with kids. Watching people try to mimic their language never goes over well, because they know, right? They see.
Totally. Yeah.
So that's clear as day. And I think they really appreciate a genuine person more than someone who's trying to be cool and sound like.
Yeah, I absolutely. I get the same thing with athletes. So you don't want to, sugarcoat anything. Just say it like it is. So you've also worked in school systems, right? So before you opened your practice, is that right?
Yeah, I've worked in lots of different places. I worked in schools and hospitals and community-based centers. New York kind of has this amazing thing where hospitals create mini clinics inside of public schools, which is you're getting kind of hospital-based care right in your public school, which is amazing.
Was that through Montefiore?
I did it through Montefiore, but all the hospitals in New York participate. There are tons of these clinics set up for both medical and mental health treatment.
And so you were what kind of role did you have there? Did you develop programs? What was that like?
So I started off as a clinician. I actually started off as a postdoc, got some training, stayed on as a clinician, and became the director of mental health services in the school where I work, and felt really strongly. So DBT, as we were talking about before, dialectical behavior therapy, is one of the most effective interventions we have for our kids, teenagers, and adults who are struggling with really strong emotions and aren't sure what to do with those emotions. And when they become overwhelmed with emotion, may engage in some ways to manage that intensity that aren't so healthy for them. And so we brought DBT into an elementary school, and
so cool.
With younger kids, it's great.
Yeah, so cool. You did that for a while, right? Before you came, because so that's when I met you, because you had just come back to New Jersey.
Mm-hmm. Yeah.
And so that's when we met.
Yeah, it was a big jump going from working in a different population to working in a private practice in New Jersey.
Yeah. Well, OCD, ADHD. I mean, these are things that people kind of throw around. Do you see a lot of that in your practice? Like, what are some of the main things that maybe parents are seeing in their kids with this high stress these days?
Yep, some stress. We're seeing an increase in anxiety and depression in OCD. I will also say that on the one hand, something really beautiful that's come about with social media is there is much more open dialogue around mental health. And so the positives of that are that kids are much more aware of the ways that they may be struggling or that their friends may be struggling. The downside of that is sometimes the language of therapy, the language of mental health is put out there. However, it is put out there in a way that isn't necessarily consistent with how we would use it in the field.
Absolutely, yeah.
And so sometimes I think that social media can present problems that aren't problems, right? That are typical developmental experiences to have.
Totally.
But wrapped in labels that feel scary. And so people's anxiety goes up instead of what would be a really beautiful way to use social media is normalizing some of these experiences instead of pathologizing them.
Like what? Like give an example, because I can think of a few of ways that have, like I'll have, athletes come in being like, I can't focus in class. And it's like, well, what class is it? It's like world history. Cool. Like I also can't focus in that.
And by the way, did you eat breakfast or sleep last night?
Right.
That is exactly. It's not ADHD just because you're struggling.
Correct.
It's not OCD. Just I double check my alarm pretty much every night. That's not OCD.
Right.
Even though it might be a repetitive behavior. So we hear the language, right? Gaslighting isn't about somebody disagreeing with you. So we hear a lot of the language of therapy, and sometimes this over-pathologizing can happen. And I find sometimes my job is actually to do the opposite of what you think it's.
Totally.
Right?
Yeah.
Just normalize the normal experience.
Yeah. Yeah. This is a little provocative, but like at like college age kids, they black out, like when they go out every so often, not healthy, not great, not permission to do it.
Right.
And it is developmentally sort of a part of the process.
It's not substance abuse. It is a healthy unit substance abuse.
That's right.
Sure.
Yeah.
But it is not substance abuse in that.
Yes. Amen. Well, you mentioned technology. So how are you seeing that in your practice? Because social media is big.
Social media is big. And I feel like 100 years older than I am because I know somebody who uses it. So trying to stay on top of it as someone who is not an active user of it can be tricky. And I think when we're talking specifically about kids and teenagers, it is a double-edged sword.
Yeah.
And so I want to be careful not to villainize social media. There's some really helpful things that come out of it that we can certainly talk about. But I think specific to kids and teenagers, just thinking developmentally about where they are is important.
As
10 to 19 age range, that is when they are at the peak of their risk-taking behaviors in, as you were just saying with college students, a developmentally appropriate way. This is the age when you do take risks. And I think what's tricky with social media is sometimes it doesn't look like a risk or see in the way that real-life risk-taking can be clear.
Right.
And so the age that we're introducing kids to social media is also an age where they are at the peak of their risk-taking. They also, in terms of measures of well-being, they tend to fluctuate the most between the ages of 10 to 19. So their mood naturally is going to be more up and down between these ages than it will at other times in their life. So we're going to see the impact of that on social media.
So parents, listen to that. Your kids will be up and down. That's normal. There's no problem with that. But I also put myself in the shoes of parents listening. And so they're going to say, well, Dr. Miller, at what age should I get my child social media?
Right. So I think that there are two different questions here. I think there is what age are our brains ready to handle social media and what age do you actually give your child social media? Because in a perfect world, we would wait until the prefrontal cortex, the part of your brain that's right here, the front of your head is fully developed so that you are ready and can understand the consequences and can manage your emotions a little bit better. But that would mean we're not starting social media till around 20, which is also not realistic and not going to happen.
Because then you're kind of holding them back a little bit, yeah?
It's not possible. So my partner does not work with children. And so I sat him down and maybe not so gently invited him to join me in watching a documentary about social media. It's like, we have to do this because we have children and we should watch it. And his takeaway was, okay, well, then they just won't have it. We can't do that either. That's not an option. Part of social development is going to include social media. And if you are going to have friends in today's society, you have to be on social media before your brain is actually ready to manage social media. So I don't think it's necessarily about when are your kids going to be ready, because you're probably going to give them access to a phone and to social media before they're actually ready.
And that's okay. So then just be okay with that.
Okay, that's okay. It does mean we have to be on top of it, right? So if we're going to give our kids access before their brains are ready to do this independently and on their own, it means having lots of open conversations about social media, making sure that our kids understand how to be safe online. My kiddos in school, they're already starting to talk about being safe online.
Oh, I love that.
In grade, they started talking about it.
Nice.
I think that's wonderful, right?
Yeah.
You're not sharing personal information. You don't know who's who. So some basic safety conversations I think are really helpful. Something that I think should be a part of that, but often isn't, is the idea of sources and knowing source.
Oh, good. But from an early age, you think, just in terms of like legitimate sources versus fake stuff? And
yeah, or even just sometimes you don't know, right? So there are some sources where you can say, okay, I think this is a legitimate source. But oftentimes the information we get online, we don't actually know where the source.
I'm like stuck on some site, like a news, a quote unquote news article will come across my feed and I'll click on it and then it's like some dead link or.
Yes.
That's what you're talking about. Yeah.
Yeah. And our kids access information so quickly.
Very quick. Yeah.
And even in person, it's a helpful conversation to have. If your fellow sixth grader is informing you about something about the way your body works, they may not actually be the expert in that either. It's true. Even for in-person conversations, we want our kids to slow down and just consider the source and create an environment where they are comfortable enough coming to us to say, hey, I heard this. I saw this online. I heard this from a friend. Is that accurate? Is that true?
Yeah.
Right?
Yeah, just check it out. So you train a lot of healthcare professionals, and I know that about you because I was lucky enough to work with you on one of your large projects.
Mm-hmm.
And so how is that presenting today? Like, are you still involved with a lot of that training of other healthcare professionals?
Yeah, I really love being upstream and downstream. So I think, it's really important to me to sit with kids, with teenagers, young adults, and help them manage through their difficult moments. But I also think we can make a much bigger impact helping other providers to also be able to do that.
Yeah. So sometimes through continuing ed, but I know you also supervise other clinicians.
Mm-hmm.
So all that type of stuff you're talking about, that's the upstream, downstream.
All the upstream, downstream stuff. And I think that as I get older, newer generations come in. It's also interesting because they come in with different experiences, right? And so their relationship to things like social media is different from mine, and it's different from parents. And I think something that's really hard for parents are our kids are having these novel experiences we didn't have, right? And so we're trying to help them navigate through situations to the best of our ability without ever having been in those same situations ourselves or really understanding the impact of it.
I always say that, like, I'll only have like a couple more years left where I'm relatable in sports, 18, 25-year-olds, like they're going to be like, what does a man want to tell me about anything?
You will be the holder of the historical data.
We'll transitioning together on that.
Yes, absolutely. I think that's another piece of advice for parents is to come in with curiosity. There was a time where I could keep up on lingo kids use. That time has long passed.
Yeah.
Not just because I've gotten older, but because the speed that being online allows for the dissemination of new language to be out there. I don't speak emoji that well. It means
I love speaking that. Wait, do you know Darty and Dage? Have you heard that?
There is a whole new language, but I would bet money that the way you use emojis is very different than the way we're 14-year-olds have.
And you would win, yeah.
Well, and the reality is it's hard to know what they're communicating to each other.
Amen.
Because it might mean one thing for us and something totally different for them. And so coming in with curiosity, without judgment, with just curiosity, can be immensely helpful in trying to...
Super helpful and super mindful.
Yes.
That was a little mindfulness. We always talk about lead with curiosity. So it's really, really good advice. And also, like, you work on bullying, and has that changed? Is that still something today?
I think what has happened kind of in the bullying sphere is there was a time where it became something that everybody wanted to talk about. And when the pendulum tends to swing in that direction, there's pushback in this direction. And I think, unfortunately, what happened is the language of bullying was used inaccurately. And so kids who were engaging in teasing or other unacceptable behaviors, but not bullying. It was all labeled as bullying. And so people got sick of it and kind of felt like it was ridiculous. But if we're talking about true bullying, right, how we define bullying, it has to meet certain criteria. Bullying needs to be between people where there is a difference of power. That power can be defined by age, by gender, by any kind of majority group you're a part of, right? So there has to be some kind of differential of power. It has to be repeated. A one-time aggressive incident is not acceptable, but it's not bullying, right? So it's repeated, it's unwanted, and there's a difference of power. So the way that you can respond to bullying is handicapped a little bit by the fact that there's a difference of power. There's only so much you can do when you're in the less powerful position. So the way that I think social media has really blown up has definitely been a concern in the same way that in real life. So when I was working in certain areas, I was surprised to learn that Halloween was sometimes a night for gang initiations.
Yeah.
It's because when you're wearing masks and you are, right, no one can see who you are, it frees you up to do things in a way that you might not in other ways. When you're online, you can be completely anonymous and do and say things, or even as yourself, not see the reaction of the human in front of you in real time, which might stop you, pause you, have you hold back a little bit. So I think that it's allowed people to be a little more aggressive in their bullying than when they're in person. And it also reaches a much wider audience. Right.
Well, that's the craziest thing. I love that you just brought, we just brought that together, because I think that I actually was giving a talk this week to a bunch of high school parents of athletes. And it was like, I was able to leave bullying and feel safe at home. Now you go home and it might still be there on social media. Like it's like incessant,
Yes.
Yeah.
And your friends on your team, your friends in your school, your friends in your camp, your friends in your religious setting, they all see all of it. They're no more. This is, the place I get away from it. Not only is a safe haven, but also where kids don't know. It follows you everywhere. That's really.
So I've learned a lot. This is super helpful. I wonder, are there any other last tools from your toolbox that you might share for some parents out there?
Yes. I would say don't be afraid to have your kids be frustrated with you. It is okay to sometimes be the mean parent. So when we think about things like access to their phones, it's okay to have them charge it in a public space at night, downstairs in your house or in your kitchen, and not have it be in their room. It's okay to say, you can have access to these things. I will be checking them periodically, and I will be checking in with you about what I see. It is so important to model the behavior we want to see. So we want them to be able to come off of their phones. Sitting down to dinner together with no phones at the table.
Nice.
It's a really beautiful way to say we're taking a break from phones. I am too. I'm not going to take work calls. I'm not going to answer anything. This is a time it lets our kids know they're important to us. And it preserves the space where we get to spend some more meaningful time together. And it models for them what we want to see from them.
Oh my God. So good. So good.
That's the hope.
Yeah. I mean, and just tools, little small things you can start with. I love the phone out of the bed. I always say no phones in the bedroom, period. And so everyone's like, well, what about my alarm clock? Buy an alarm clock.
That's right. What about if I want to listen to music? We were able to access music before we had phones. There are so many ways. Everything your phone does outside of social media or talking to somebody else, we can find other ways to take care of it.
You can absolutely find some other ways to take care of it. Dr. Miller, thank you so much. I love this, and thank you so much for being here. So where can people find you?
Yes. So the best way to find me is on our website, which is www.behavioralcarenj, like New Jersey.com.
Wonderful. So head to we'll have that in the show notes too, because Dr. Miller is really, truly a gifted provider and just a wonderful human being. And so if you're stuck in that and kind of trying to find your way with your children, she is a place that can help you. So as you know, May is Mental Health Awareness Month, and our priority is to get the awareness out there of mental health. And that's what we want each time on this podcast. Approximately 1 in 5 teens and adults are affected by mental illness, and it is my mission to reduce stigma and promote support of this. So there's also lots of resources at NAMI.org, and you can learn more about that if you have any challenges to get some additional support. So again, thank you so much for being here. If you like the show, please like, follow, and share. Everything's at officialdrpete.com. And I will see you next week where we do some more talking about mental health for May. So until then, spread a little kindness and stay well.